There is a little bit of a difference, and I felt it myself. If I am truly a frontline nurse anymore, because I don't work in a hospital, and I don't have my hands on the patient, and a lot of my nurses that are working on my team, they don't have their hands on the nurse or on the patients either. And at the end of the day, though, while we're not in there changing dressings and putting medicines through a line, I think we're still very much frontline nurses, because just because they're not in the hospital doesn't mean they're not about to be in the hospital. But if we give them the education that we can first, maybe they won't ever get to the hospital port. So I think, yeah, there is a little bit of a difference. We might be on the phone all day as opposed to changing dressings and going in and out of rooms, but we still have a very effective part in our patients' care. When I was talking to a lady, she had just been recently diagnosed with diabetes, and she was rather young for our patient population, but this was entirely new to her. So she was just like hungry for any kind of education that we could give her. I sent her out some education talking about carb counting and diet plans. And the next time I was able to talk to her, which was probably about 2 to 3 months later, she was giving me her labs and the things that she's accomplished since then. And she had been able to lose about 10 to 15 pounds, and her A1C, it was, if I'm remembering right, it was up like near 9, 10, and we want it to be down near 6, and she had come down several points. So just between exercise and her carb counting, dealing with her diet a little bit better, from the education that we were able to send her, she was able to make a true effect on her life, and she was happy. So it was fun to hear.